Hey YouTube, I just wanted to go over a couple things and talk to you about, some stuff. Recently I received some more real scientific hemp oil, and this is the gold liquid, which is kind of like the paste, but it's filtered one extra time. And I just wanted to, go over a couple things and explain some things. It says, real scientific on the bottle. And I mean, they're not kidding when they say real scientific. I've been to the lab. I've seen the standards of the lab, and it's just probably the best quality high CBD hemp oil on the market today. There's been a lot of people talking bad about it, but at the same time, this stuff has won 3 cannabis cups in a row. And when I get overly hyper and I have anxiety, things like that, and this hemp oil literally takes all of that away. I'm able to concentrate, and I feel very calm, and it seems that I'm able to think and speak more coherently, and I just think and reason better. I noticed that when I take real scientific hemp oil, I have better problem-solving skills, and it seems that I make better decisions when I take it. And the active ingredient is hemp-based CBD, cannabidiol, and I've just witnessed way too many people, including myself, having miraculous, results. And I mean, I'm not going to talk about real scientific hemp oil right now. I'm just going to talk about CBD, cannabidiol. There have been cases where seizure patients have been told that there's nothing we can do for you, and then they start taking CBD, cannabidiol, and all of a sudden their seizures have been reduced by over 60% in a lot of cases. And I've seen it personally happen with a special needs girl in a wheelchair because of her seizures. Was having 30 40 plus seizures a day. Ever since she's been taking cannabidiol, she's going weeks at a time, sometimes over a month without a single seizure. And there's all these studies that show that cannabidiol is really good for you. There's even a United States government patent for cannabidiol as an antioxidant and I don't know how to pronounce it. Sorry, a neuroprotectant, something like that. And it actually protects the brain from damage, according to the United States government patent. And it's a very simple thing to take. This is a liquid version. It's 15.5% cannabidiol in it, and I just like it a whole lot, and it just takes away all my symptoms of anxiety, hyperactivity, all that stuff. And I mean, it just frustrates me when I hear people talk bad about it when there's really nothing bad about it. I haven't had any negative side effects from it at all. The only thing that I noticed is that I feel a little tired throughout the day, but I have a really hard time sleeping every night, so it's good that I feel tired. I mean, I feel like I could take a nap right now. I've been staying up pretty late and waking up really early, and I used to be on Seroquel XR and 800 milligrams, which is actually the maximum dose, and I just don't take that anymore ever since I've been using real scientific hemp oil. And I'm just very fascinated by this stuff because if you do your own research on it, I mean, they even have studies going back from the 1970s that say CBD helped with seizures. There's a blind clinical trial that showed it to be just as effective as atypical antipsychotics in treating, schizophrenia and other psychiatric disorders. And I mean, it's just amazing to me what this stuff has done and what I've seen it done for other people. I've spoken to numerous parents who've had significant seizure reduction since using CBD, cannabidiol rich hemp oil, and it's just really amazing stuff to me. And it's it's just so unbelievably totally safe. When I visited California, I got a tour of the lab, and they run all these tests to make sure there's no mold, no fungus, none of that, stuff. So it's all, great. They've even produced before 98% CBD hemp oil, which has won, like I said before, numerous cannabis cups. And I expect this 420 for Hemp Meds PX to take home another cannabis cup. And it was just such a great experience being able to hold the cannabis cup and, seeing people go from, 30 plus seizures a day down to, weeks at a time, sometimes a month at a time without, any seizures. And there are hundreds of kids out there that have had improvements because of CBD. And there was, according to the American Cancer Society, or not them, I think it was like cancer.gov, it said that cannabidiol induced programmed cell death in breast cancer cell lines. I was watching a video earlier that explained how it protects the brain from damage, and cannabidiol is just a wonderful compound, and I think it's going to continue to grow in popularity. And it honestly doesn't even take that much to receive a medical effect. I take Klonopin and trazodone, 6 Benadryl, 4 valerian root, and 3 melatonin at night to help me sleep. But ever since 6th grade, I had been taking a lot of medications even during the daytime, just to keep me calm, to keep me mellow, to keep me well balanced. And my 9th grade year, I was put on 800 milligrams of Seroquel XR. A lot of stuff was going on back then. Bad decisions. Lots of symptoms, depression, horrible anxiety. But the medication that I was put on had a list of horrible side effects, and the side effects really scared me. And I've always known a lot about the benefits of alternative, holistic medicine and all that. But based upon my personal experience, this CBD is more effective than any medication I've ever been on in regards to keeping me calm, anxiety, all that stuff. Sometimes I would wake up in the morning and I would just feel completely dizzy, and I'd actually, the best way I could describe it is, imagine like waking up in the morning, and even though you're completely sober, you feel like, you're kind of like drunk, is what it felt like. And I couldn't concentrate. I'd always zone off, and I'd get really upset. And when you wake up in the morning and you feel kind of like you're drunk, even though you're sober, that causes a lot of anxiety and paranoia and things, like that are, a lot of that stuff is really hard to live with. Terrible anxiety, depression, paranoia. Now we're even seeing studies coming out that say, cannabidiol is good at lowering blood pressure, all that good stuff. So the fact that this one compound is doing all these things is just, completely amazing. And I'm excited about more cannabinoid-based supplements. And I'm just, completely, blown away at the improvements that numerous seizure patients, have had. And I'm blown away that, I don't take 800 milligrams of Seroquel anymore, which was the maximum dose that I was on. I was on 800 milligrams, excuse me, sorry about that. I was on 800 milligrams of Seroquel XR when I was 16, even though that drug wasn't approved for people under the age of 18. They gave it to me anyway, And I remember I was telling the doctor that I didn't want to take Seroquel XR anymore, and he said, well, you're always going to have to take it, or you're going to have those symptoms. You're going to have anxiety. You're going to feel depressed. You're going to, you know, how I'd always describe it to him was that I just felt like I was not sober throughout the day. I felt like I was dizzy. I felt like I was kind of, you know, drunk, and lots of anxiety, horrible sleeping issues. And he told me that if I quit taking Seroquel, that would happen. And I quit taking Seroquel, and sure enough, I'd wake up in the morning and I felt like I was completely drunk. It felt like I drank like 7 or 8 beers, even though I hadn't had anything to drink. That's how it felt. And it made me very panicky, and you know, I was getting dizzy all the time. You know, random, you know, dizziness just out of nowhere. It'd feel like the room was spinning, you know, real fast. And you know, I had a CAT scan, and they said that it's all, you know, like it's all in the mind. It was nothing, you know, life-threatening, but they said that I needed to take prescription medications, and instead this is what I do. And I like cannabinoid therapeutics, and all it takes is like that much, you know, right there to show you, and that'll get me like you know, feel good throughout the entire day, and I won't have any, you know, negative symptoms. But one thing I wanted to address is that there's a lot of people out there that are saying that you know, RSHO doesn't work because it's hemp-based CBD. It's not CBD from marijuana. But what you got to understand is that the chemical structure of the compound is the exact same, regardless if you extract it from marijuana or hemp. And you know, hemp is actually cannabis sativa, and so marijuana and hemp are both cannabis, but marijuana and hemp are different. If that makes sense to you. A lot of people get confused by it, but if you think about it, it's really not that confusing. And you know, the safety standards are just amazing. Like their lab, they had this big booklet of like test protocol, and it even showed where some mold had been detected, and even though it was just a little bit of mold, they threw everything away. That's how serious they take you know, safety at HempMeds PX. And I mean, the San Diego Science Center just really impressed me. And you know, there's all sorts of PhD scientists that are jumping all over CBD. And like I said, you know, it doesn't matter where the CBD comes from, as long as it's CBD, you know, naturally occurring CBD from the cannabis plant species. And I mean, it's just, they have the highest standards, and you know, a lot of people say, well, it's so expensive. You know, it is, you know, expensive, but I mean, they have a program for people with epilepsy and people who, you know, can't afford it. And, you know, it's never hesitate to call up there and talk to a representative. Unfortunately, no one can really make medical claims. That's why I encourage people to do their own research. But that's because there's current FDA clinical trials in regards to different cannabinoids. You know, but based upon common sense, I think your average person should assume that CBD has a lot of good benefits. You know, and I mean, just read the United States government patent. You know, it talks all about it. And I mean, it's just, improvements are amazing. I mean, it's almost, to me, you know, when I see a little girl that you know, is having all these seizures, you know, 40+ seizures a day. Some, you know, little kids have, you know, more than that, and then they start taking Cannabidiol, and you know, they go weeks at a time with no seizures, and then based on you know, different tests and everything, they can prove that the seizures have been reduced by over 60% from a compound in a plant. And I think that Dr. Sandra Gupta has done a great job explaining the medical benefits of cannabinoids. And I'm predicting, I'm predicting that HempMeds PX is going to take home another Cannabis Cup this upcoming 420. So I'll be interested to see if my prediction is right. But like I said, I mean, this is very, professional. This is not stuff that's made in some guy's kitchen, and I mean, if you want to make cannabinoid supplements, in your kitchen, I support that, power to you. But I believe it is important to take a scientific approach, and that's exactly what real Scientific Hemp Oil is all about. They're trying to take a scientific approach to it, and really, doing a lot of research and things like that. Medical Marijuana Incorporated and Cannavest gave Canna Life a $1.5 million, series of financing. And once these clinical trials are done, people will be able to make medical claims. But just based upon what I have seen, I consider it better than any medication I have ever been on my entire life. I feel like that it's just perfect for ADHD, bipolar, all that stuff, anxiety, insomnia, depression, and it really slows you down. And a lot of people, they assume when you're using, cannabinoid-based, supplements or therapeutics that you're getting extremely high. And I don't really feel high from Cannabidiol or Cannabidiol. It's whatever you want to call it. Cannabidiol, Cannabidiol, CBD. I really don't feel high from it, I just feel more mellow. And I remember when I first started taking it, my symptoms basically went away within a week. I wasn't feeling dizzy anymore. I was getting better sleep. And I'm just so thankful for cannabinoid therapeutics. And I believe that once every cannabinoid is concentrated to 98% purity, that it might be possible to cure a lot of different, diseases. They've actually known about CBD's anti-epilepsy properties since the 1970s, but they never, I guess pharmaceutical companies and lobbyists and, alcohol companies, I guess kind of, covered it up, paid off politicians. Unfortunately, there's a lot of corruption within the medical establishment, but that doesn't mean everybody's bad. And now we're seeing big-time companies getting involved in cannabinoid research and therapeutics. There's a gum, Med2RX, which is going to be I believe it's a 5-to-5 ratio of CBD and THC. And there's a company called GW Pharmaceuticals in Europe that has an outstanding grow room, and I'm just very thankful that the medical establishment is starting to admit that cannabis has medical properties. And it's not a bad thing that big companies want to get their hands on cannabinoid therapeutics. It's actually a good thing, because that means millions and millions of dollars can be put into research, which is actually what we need. I'm all for, dispensaries. I think marijuana should be legal for recreational use. But I think when it comes to medical use, we do need scientists and millions of dollars in research and FDA, approvals. And what a lot of haters don't understand is that when CBD and THC, when they pass FDA clinical trials, which I'm pretty confident they will, then they're going to have to reschedule marijuana. They're going to have to, because right now marijuana is listed as a dangerous substance that has no medical value, when in reality no one's ever died from marijuana toxicity. Marijuana is not a gateway drug. but this video isn't even about marijuana. I just wanted to clear the air about the safety of real scientific hemp oil. This is what it comes in, and let me try to get a good view on the camera of it has the supplement facts on the back, and it says that it has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease, but I have successfully used it to treat myself, and I know numerous other people have as well. And there's all sorts of different products that you can check out at hempmedspx.com. They have Cipidex and all sorts of low-dose CBD products. I need a high-dose CBD, and a lot of the little kids who have seizures, they're taking high-dose CBD. I mean, it's just such a wonderful supplement, and I'm sure just by the look of the YouTube video, you can tell that I'm extremely mellowed out right now, which is exactly, what I need, and I'm extremely excited about more research into cannabinoid therapeutics, and Canna-Life Sciences really fascinates me because of all the PhD researchers that are on it, and doing all this amazing research, and hopefully CBD will become just as common as vitamin C, because I think that people do need to stimulate their endocannabinoid systems, and overall it's just a great product, and I'm just so unbelievably grateful to HempMeds PX and everybody, who's, especially, I mean, when they flew me out to California, it was one of the funnest times I've ever had. I got to meet this kid named Blake, which I met on the internet. He was having a lot of seizures, and his seizures have been drastically, reduced. And we went to the zoo. We were riding in limousines. It just felt like I was a superstar. I mean, to get picked up, from the airport in a limousine, and then taken to a really nice hotel with unlimited room service and all that. It was just I'm forever grateful, and I think that a lot of people can benefit from CBD, and sometimes it breaks my heart. I see people who are suffering. For a matter of fact, my mom's a teacher, and she teaches a class of kids who are emotionally disturbed, and a lot of times they throw their desks and they try to attack teachers and stuff like that, and it just breaks my heart that they're not on CBD, because I believe that it could help them so much. One thing that's great in regards to seizures is that I believe, unless I'm mistaken, that one of the head people at the Epilepsy Foundation is now, in favor of cannabis oil, because, I mean, when you have a little girl, from Colorado that, going, a really long time without any seizures, it's just miraculous. I mean, the fact that
there was a little girl in Colorado that was having, hundreds of seizures, couldn't walk, couldn't talk, couldn't eat. The doctor told the family that they ran out of medical options, and to basically just, let this little girl die. I know the parents even signed the do not resuscitate order, but because of, cannabis with high concentrations of CBD, her seizures have been reduced by, over 70%, and she's walking and talking, and, it's just a miracle. And I mean, it's very frustrating that everybody doesn't know about cannabinoids. I look forward to all cannabinoids being super concentrated to 98%, and that is only possible when scientists and researchers and FDA approvals come into play. And I'm just so thankful, to God and to everybody at HempMeds who really came out with this oil that's available in all 50 states. And I'm really excited about the future.
And I mean, right now I just feel so calm, and you know, I just feel so great, and you know, it's just such a big difference, you know, from a couple years ago. And you know, I just want, you know, every time I see a kid who has seizures, or if I hear somebody talk about epilepsy, I tell them, why don't you try CBD? You know, and they don't even know what CBD is, even though it's basically destroying epilepsy. And my point is, when they figured out that THC and CBD caused cancer cells to commit suicide, why didn't they publicize it all over the news? I mean, the government knows about it. You know, science knows about it. You know, we have a medical system where you can't really make claims until, or the companies themselves can't make claims until they have FDA approval, which is what Medical Marijuana Incorporated is currently undergoing with. And I'm just so blown away at a CBD cannabidiol, and I'm just so thankful to everybody who's getting this stuff out there. And I want to help spread the word that I believe that children of all ages should take CBD, you know, from the day that they're born. And I've just noticed a huge difference in so many different people's lives because of you know, CBD, and the professionalism and the safety standards at HempMeds PX is, you know, it's just amazing. And I just wanted to make this little video and just tell everybody that you know, you should definitely you know, try this supplement, especially if you are real into, you know, healthy lifestyles. You know, just give CBD a try. I mean, check out hempmedspx.com. You know, they have a gum. They have all sorts of cool stuff. They have some shampoos, you know, that, you know, in the shampoos it's more hemp oil, but, you know, hemp seed oil in the shampoos, but it still has some CBD in it. But as far as this is concerned, this is probably, if it were up to me, every single person in the whole world would take at least a couple drops a day, because I just don't see why people don't take it, because it's, you know, the best. And 3 cannabis cups in a row don't lie. So let's see this coming up 420. Let's see if HempMeds PX takes home the cannabis cup, and I'm betting that they will. So we'll see. So God bless everybody out there, and if anyone has any questions about CBD, you know, just let me know, and I'll try to answer questions, you know, for you. And I recommend everybody to go to www.hempmedspx.com and you know, do research on that compound CBD. And once you realize what I'm saying is true, you know, give it a try. Like I said, peace out, and I look forward to HempMeds PX taking home the Cannabis Cup this coming up 420 in Colorado, in Denver. Thanks a lot, guys, and peace out, and happy healing.